Okay, everybody, we just want to take a few minutes here and demonstrate how we would apply some of the other treatments we talked about for chest injury. So we've got our injury to our patient's chest. Please excuse our mannequin, it's the best we have. But so we've exposed the chest and we identify that we have an injury. What's the first thing we want to do? Well, one of us is going to put a gloved hand on. So Ian's going to throw a gloved hand on that. We're going to use a vented chest seal this time. Now, some products come with a 4x4 or some type of wipe. What these are designed to do is to clear blood away before you apply your chest seal. So if you do have some bleeding, we can simply wipe that away, which will help the adhesive work on the chest seal. Now, when we're going to use a vented chest seal, it's important that the vent actually ends up over the injury. So we don't want to have, adhesive over it. We want to have the actual vent. So Ian's got his hand in place there. Like I said, I'm gonna go halfway because this stuff is sticky. Get my vent ready. Okay, I'm gonna let Ian know I'm ready to go. I'll place that over top and we'll simply pull the rest of the backing out from underneath. And there we have our vent right over top of the wound. Now if we're gonna talk about a little bit more of an improvised treatment, chest seals are excellent, and at any time that we have them for chest trauma, we should use them. And I would like to add in as well that any hole from the clavicle to the belly button, a chest seal is a suitable treatment. If you have multiple injuries from like a mortar or artillery blast, it is acceptable to cover the whole injury with a chest seal. If we're running short on those things and we're starting to get into a bit of improvised treatments, these are not going to be as effective because they simply aren't as sticky. Our patients are going to be perspiring, they're going to be sweating, they're going to be bleeding. So a lot of tapes just don't have the grip to be a suitable treatment, but we're still going to do our best. So wherever possible, Ian's going to throw his hand on there. We're going to use an Elias. We're going to wipe away, clean up as much sweat as we can so we have a nice dry surface. Place the occlusive dressing. Let's just twist it a bit, Ian. There we go. We have a couple options with this. We can do 3 sides of tape, or we can do all sides of tape. The important thing is that we cover the injury and air is not able to move into the chest. So we'll start at the top. Now, which side do we do for our 3-sided? I guess it kind of depends. For this one, I'll have my untaped side towards the patient's shoulder. Now, like I said, there's a good chance that your patient may sweat this off, but hopefully that buys you enough time to either get them to a better treatment area or to get some more supplies. So that's with the occlusive from your Elias bandage. The next thing we'll do, very similar, is if we have a piece of packaging or a bag, we can use that as well. Same concept, we find a hole, Ian's going to cover it up. You know what, Ian, let's actually rotate that. We'll do all sides with this one. Oops, missed a bit of the skin there, no problem. We'll just make sure that we capture it this time. There we go. We'll catch that last top one. And there's our last. Is this ideal? Absolutely not, but will it work in a pinch and buy our patient some time? Maybe, and that's the important thing.